Welcome to the General Practice Supervisor Onboarding Guide, presented by the Gold Coast Primary Health Network Clinical Placements team for both Bond and Griffith Universities. General practitioners provide accessible, comprehensive and longitudinal care, making them invaluable in ensuring the health and well-being of individuals and families within communities throughout Australia. As a GP supervisor of medical students, you feel a crucial role influencing the trainees you mentor and the future healthcare system. Your contributions help the next generation of doctors be well trained to provide high-quality, patient-centred care. We have developed this onboarding guide in consultation with heads of general practice from Bond and Griffith University. The key areas that will be covered in this guide are an overview of the GP supervisor responsibilities and requirements, the placement process, providing feedback throughout the placement, completing and submitting the ITA and PIP teaching forms, and contact details for the GCPHN clinical placements team. Watching this onboarding guide will give you an understanding of the expectations required of general practice supervisors and the needs of the medical students. The GCPHN Clinical Placements Program currently places Phase 1 Griffith medical students, Year 3 Bond medical students, and final year medical students from both Bond and Griffith University to complete their core and elective general practice placements. The supervisor's responsibilities and requirements will vary dependent on the student year level. Placements should be tailored to meet the university's specific student learning objectives and required outcomes of the placement. Final year student placements are typically more advanced and tailored towards preparing students for the transition into the workforce. Placements for Phase 1 or Year 3 students are usually more exploratory in nature, providing students with a broad overview and helping them to understand the basics of general practice. An overview of the key responsibilities include supervision and teaching, clinical training, feedback and assessment, professional development, ethical and professional conduct, patient safety, time management, team collaboration, support and encouragement. During the placement, the general practice supervisor should organise in-practice teaching sessions to maximise learning opportunities for students, obtain consent from patients for student participation, identify situations to avoid language and behaviour resulting in bias or stigma to patients and students, help students develop clinical reasoning within a GP consult, evaluate students' experience and knowledge when completing the ITA. At the GP's discretion, and if achievable, following considering factors such as the student's skill level and evaluative readiness, it is highly desirable, should there be an option, the student is provided with a treatment room for consultations. By providing a well-rounded and supportive learning experience, the general practice supervisor plays a crucial role in shaping the medical student's future as a competent and compassionate healthcare professional. General practitioners who participate in the program must be currently registered with AHPRA as a specialist GP with no restrictions on their registration. The practice must be accredited or undertaking accreditation. The allocation of students and accompanying detailed documentation will be distributed via email to those general practitioners assigned to students in either semester 1 or 2 by the GCPHN Clinical Placements team. Semester 1 allocations are sent in early December for the following year. Semester 2 allocations are sent between May and June, mid-year through the placement year. The GCPHN Clinical Placements team collates and distributes university and cohort-specific documentation emails at least 6 weeks prior to the placement commencing to you and your team. 2 weeks prior to a placement commencing, the student is required to complete a GP placement orientation advising of all requirements and to contact the practice to confirm the placement. If the student has not contacted the practice at least 1 week prior to the placement commencing, we ask that you contact the GCPHN Clinical Placements team so that we can follow up with the university. On the first day of placement, we encourage you to sit down with the student and engage in an open discussion on what your expectations are and what the student would like to gain from the placement. This is a great opportunity for you to understand where the student's capabilities currently sit, how you can position the placement to best reflect the student's capabilities, and engage the student on how and when you will provide feedback throughout the placement. If you are supervising a final year student, discuss future placement dates and the roster for the 7 weeks the student is on placement that works for you and provides opportunity for interactive participation. If you are supervising a Phase 1 or Year 3 student, the days are set as indicated in the practice schedule and can only be changed in consultation with the university. This is due to university timetabling requirements. Your team should also ensure that the signage provided in the documentation email is on display as per RACGP requirements, orientate the student to the practice, confirm the student has a university copy of the PIP teaching payment form with them. Attendance of the placement is an essential and mandatory training requirement of the university. If the student is unable to attend any day of placement, the student will need to arrange a make-up day with the practice based on mutual availabilities. Importantly, if a student appears below the expected standard for their year level, or if there are any other concerns or issues experienced, please contact the GCPHN Clinical Placements team as early as possible so that we can assist with your concerns. The universities like to know so that they can provide extra support to such students. The purpose of feedback is to help the person whom it is directed. In order to do this, it should be given in such a way the person understands it, accepts it, and can do something about it. To do this, it is ideal to agree with the student on day 1 that you will be giving feedback throughout the placement and ask permission. Share rather than insist. Schedule when and how you will deliver feedback throughout the placement. Understand student perception. Ensure feedback is a two-way conversation with a buy-in from the student. Provide closing feedback in alignment with completion of the ITA. On completion of all placements, we ask our students to give feedback on the placement, allowing insightful feedback to be shared with you as the GP supervisor. The GCPHN Clinical Placement team facilitates GP trainer workshops on behalf of Bond and Griffith University that allow our GP supervisors to connect and discuss topics including how to provide effective feedback and the benefits to both the student and the supervisor. Invitations to these workshops are sent via email and advertised via GP News and other GCPHN platforms throughout the year. Completing the in-training assessment, known as the ITA training assessment, involves several steps from both the student and the supervisor. The student is advised of their requirements to complete the ITA at their orientation prior to the placement. As the GP supervisor, you will need to consider the level of the student and the following key steps involved in providing a well-rounded placement in conjunction with ITA requirements that include preparing for the placement, observing the student, collecting feedback, reviewing student assessment requirements, organising and delivering feedback at appropriate times, creating an action plan, completing and submitting the ITA. Students attend the placement with a University Certified Services Australia Practice Incentive Payment Form, known as the PIP Teaching Form. Throughout placement, sessions must be recorded and signed off by the GP supervisor. On the last day of placement, it is important that one of your team, such as your practice manager, meets with the student to ensure the PIP teaching form is fully completed in accordance with Services Australia and university requirements. If you have any questions or require further information and support before, during or after supervising a medical student, please contact the GCPHN Clinical Placements team. We look forward to having you on the program and supporting you and your team to deliver valuable general practice placements that enrich medical students' education equipping them with essential skills and knowledge for their future careers in medicine.